So you have pain in your shoulder and the MRI confirms you have a rotator cuff tear. What's your next step? Should you get surgery? Today we're going to give you the truth about the outcomes of surgery versus non-surgical care for a rotator cuff. Hey, it's Glenn here from Mehab, the world's leading physical therapy alternative, where we educate and empower you to take control of your recovery. If you're new here, make sure you click that subscribe button, and all the links we mentioned in the video can be found in the description below. As always, this information is meant for educational and demonstration purposes only. With that out of the way, let's get into it. Rotator cuff disease is one of the most common causes of shoulder pain and covers a wide range of conditions including rotator cuff tendinopathy, subacromial bursa pathology, and partial or full thickness rotator cuff tears. People with symptomatic rotator cuff tears typically have pain, loss of strength, or limitations with active range of motion. Rotator cuff tears can occur at any age, but tears in young people are usually associated with a traumatic event, such as a shoulder dislocation. Tears found in the middle-aged and older adults are often not associated with a precipitating mechanism of injury or event. Cellular studies have found that rotator cuff changes are typical of other degenerative tendon disorders. Other than age, additional risk factors include high body mass index, hypertension, and smoking. The prevalence of asymptomatic or pain-free rotator cuff tears is pretty common, and it becomes increasingly common as one gets older. This means that tears appear to be a normal part of aging and are unlikely to be related to symptoms. Before we get into what research says about rotator cuff surgery, let's do a quick overview of the reliability of MRIs for shoulder pain. As I've mentioned before, MRIs are great at finding quote-unquote problems, but are very poor in determining if they are the cause of your pain. A study in 2011 imaged 200 consecutive patients with shoulder pain to identify abnormal structures. Abnormalities were then given a guided diagnostic block, meaning they blocked the pain capabilities of those structures. Despite blocking pain from those abnormalities, over 1/3 had no change, proving that these abnormalities were not the cause of any pain. Additionally, another study in 1995 performed MRIs of 100 people without pain. Out of those 100 patients, 34% had a rotator cuff tear, and 75% of them had AC joint arthritis. The next study is going to blow your mind. In 2013, a study looked at the MRI findings in Major League Baseball pitchers without any pain. And although it was a small study of 21 pitchers, the results are pretty amazing. 11 pitchers had a rotator cuff tear. 9 had an articular cartilage tear. 2 had a full thickness rotator cuff tear. 10 had slap tears, which are tears in the labrum, and 13 had either an anterior or posterior labral tear. These professional athletes, placing incredible stresses through their shoulders, had no symptoms indicating any problem in the shoulder. No loss of motion, no pain, no weakness, and no loss of throwing velocity. So how do you know if your finding is relevant to your pain? Well, you can't from an image alone. Image findings have to be correlated with your symptoms and/or mechanism of injury. Reports of abnormalities on an MRI, especially in those over 40, should be considered irrelevant and normal until proven otherwise. If your image findings do correlate with your symptoms, the next decision that needs to be made is what to do: conservative care or surgery. So let's look at the results of a large study in 2019 which summarized 9 trials with over 1,000 participants. The study found the following. Pain reported on a scale of 0 to 10, with 0 being no pain, was 1.6 for non-operative treatment and 0.7 for those who had surgery. So not a huge difference. Function, rated 0 to 100 with 100 being better function, was 72 for non-operative treatment and 78 for surgery, showing only a 6% difference. Patient treatment success scores, where patient satisfaction with outcome is rated, reported 7% more people reported satisfaction with surgery. Again, that's only 7%. Overall quality of life score was basically the same, with non-operative care being slightly better with 58 versus 57 for surgical patients. Our first suggestion is not to freak out about your MRI results, especially in the absence of a traumatic event. Any result should be considered irrelevant until proven otherwise, especially if you are over 40 years old. Research is not clear on whether rotator cuff repair surgery provides meaningful benefits to people with symptomatic tears. It appears that it provides little or no clinically important changes with respect to pain, function, overall quality of life, or patient perception of treatment success. Remember, time is on your side, and the body is remarkable at healing or adapting to change. Surgery is always an option, but conservative management is not. Thanks for watching, and before you head out, please hit the like button, share us with your friends, be sure to click that subscribe and notification bell, and we'll catch you on the next one.